Many Americans suffer from diabetes. Since 1970, there has been a decrease in age-standardized death rates in 4 of the 6 leading causes of death in the United States. Diabetes is the 6th leading cause of death in this country, and death rates for diabetes have, by contrast, increased by 45% since 1987. Despite the growing prevalence of diabetes among the U.S. population and the increase in death rates related to this condition, Social Security disability awards for diabetes has not substantially increased over the past 10 years. Only 2.9% of all disability beneficiaries were awarded for endocrine disorders in 2000. The total for 2008 was only slightly higher at 3.03%. One possible reason for the dearth of awards may be the changes to the listings for diabetes at 9.08 in 2001. At that time, Social Security eliminated the criteria for amputations at 9.08c, which at the time read that a person would be disabled for amputations at or above the tarsal region, which is the ankle, due to diabetic necrosis or peripheral arterial disease. The agency justified the elimination of this criteria with the following explanation. Since we published these listings, significant refinements in surgical techniques, such as developments of improved soft tissue flaps to cover the bone stump, have been made. This has resulted in more durable stumps. Engineering advances have produced prosthetic devices which minimize and distribute stress so that some individuals wearing artificial limbs after amputation above the tarsal level for any reason, including diabetes and vascular and arterial disease, are able to work. Since the publication of the new listing criteria for amputations, the incidence of diabetes-related lower extremity amputations has risen considerably. However, it is doubtful that diabetics have benefited from the engineering advances referenced above. Lower extremity amputations resulting from diabetes is generally associated with diabetic neuropathy or poor circulation in the feet and legs. Both of these conditions would logically complicate the ability to use a prosthetic device, which requires adequate healing and nerve restoration. In fact, not only are diabetics less likely to heal well enough to use a prosthetic, they are also more likely to endure more amputations. In a study published well before the listing changes, from 9 to 20% of people with diabetes who had already experienced an amputation underwent a second amputation within 12 months of the first surgery. 5 years after the first surgery, 28 to 51% of diabetic amputees had undergone a second amputation. Similar data was confirmed more recently in studies performed in Texas along the Rio Grande Valley border. One clear factor associated with lower extremity amputation complications in diabetics is access to health care. This was noticed by researchers in 1989. In their report, they wrote, "Despite evidence that preventative foot care programs can decrease the incidence of lower extremity ulcers and amputations by 44 to 85%, there are still many people with diabetes, young and old, who have no access to preventative services for routine foot care or diabetes management." In my own practice, I have seen quite a few diabetics who undergo amputations and who are never fitted for prosthetic devices. When I query my clients, they often say that their providers have not even discussed artificial limbs as a treatment option. While these clients testify to this reality, most judges will not consider that the claimant either meets or equals the listing for an amputation. One reason is the actual language in the new listing. The new listing states one or both lower extremities will be found disabled if the amputation occurs at above the dorsal region with stump complications resulting in medical inability to use a prosthetic device to ambulate effectively. Claimants may still be found disabled, however, because the new regulation requires that an examiner evaluate the condition of the stump without the prosthetic device when there is an allegation of a medical inability to use a prosthetic device. It seems that even though a claimant may not meet the listing, If they have some other reason why they cannot use a prosthetic device, they can still be found disabled if they establish an inability to pay for a prosthetic device. Most judges won't accept this concept, but the regulation does state it is unnecessary to evaluate an individual's ability to walk without the device. This is because we recognize that individuals with this type of lower extremity amputation described in the listing will have an inability to ambulate effectively, as defined in the listing, when they are not using a prosthetic device. This would be true whether they do not use prosthetic because they cannot afford one, because the prosthetic has not been prescribed for them, or for some other reason. Although the regulations do not include issues of cost and availability of treatment, Social Security Ruling 8259 does include an individual's inability to afford treatment and/or accessibility in the local community as a justifiable cause for failing to follow treatment, and therefore would not preclude a finding of disability.